Imagine this. You're recovering from surgery, and your muscles feel stiff and weak. Simple movements seem impossible. This is where passive movement physiotherapy comes in. Passive movement is a gentle form of therapy where a trained physiotherapist moves your body for you. You don't actively participate by using your muscles. Instead, the therapist gently guides your limbs through their range of motion. This gentle approach is especially helpful when you're recovering from an injury, surgery, or dealing with a condition that limits your mobility. It's like giving your body a helping hand towards recovery. Passive movement isn't about pushing your limits. It's about maintaining and improving flexibility, reducing pain, and promoting healing, all without you having to exert yourself. Passive movement physiotherapy offers a wealth of benefits, particularly for those struggling with limited mobility. One of the most significant advantages is its ability to prevent muscle shortening and joint stiffness. When muscles aren't used regularly, they can shorten and tighten, restricting movement. Passive movement helps to gently stretch these muscles, keeping them long and flexible. This is crucial for maintaining a healthy range of motion in your joints. Beyond maintaining flexibility, passive movement also stimulates blood circulation. This increased blood flow delivers essential nutrients and oxygen to injured tissues, promoting healing and reducing inflammation. Let's bring passive movement to life with some real-life scenarios. Picture an athlete recovering from a torn ligament. Passive movement can help them regain knee flexion and extension without putting excessive strain on the healing ligament. The therapist might gently bend and straighten the knee, gradually increasing the range of motion as the injury heals. Now, imagine an individual who has suffered a stroke. Passive movement can be instrumental in preventing muscle contractures and maintaining joint flexibility. The therapist might passively move the affected limbs through their normal range of motion, such as rotating the shoulder, bending the elbow, or extending the wrist. These gentle movements help to maintain muscle length and prevent the joints from becoming stiff, ultimately aiding in the individual's recovery process. Targeting conditions. How passive movement provides relief and support. Passive movement physiotherapy isn't limited to post-injury recovery. It extends its benefits to a variety of conditions. For individuals with arthritis, where joint pain and stiffness are common, passive movement can provide much-needed relief. The gentle movements help to lubricate the joints, reducing stiffness and easing pain. Patients with neurological conditions, such as cerebral palsy or multiple sclerosis, can also benefit from passive movement. The therapy helps to manage muscle spasticity, improve range of motion, and prevent contractures, enhancing their overall mobility and quality of life. Techniques and exercises. A glimpse into passive movement therapy. Passive movement therapy encompasses a range of techniques, each tailored to address specific needs. One common technique involves gentle, rhythmic rotations. Imagine a therapist gently rotating a patient's shoulder in a circular motion. This movement helps to improve flexibility in the shoulder joint and surrounding muscles. Another technique utilizes sustained stretches, where a limb is gently held in a stretched position for a short period. This helps to lengthen shortened muscles and improve flexibility. Throughout these techniques, the therapist constantly monitors the patient's comfort level, ensuring a pain-free and relaxing experience. Finding a qualified physiotherapist. Your partner in healing. Embarking on the journey of passive movement therapy requires the guidance of a qualified and experienced physiotherapist. These professionals are trained to assess your individual needs, develop a personalized treatment plan, and administer the therapy safely and effectively. When searching for a physiotherapist, look for someone who specializes in passive movement techniques and has experience treating your specific condition. Don't hesitate to ask about their qualifications, experience, and approach to treatment. Remember, open communication with your therapist is key to achieving the best possible outcomes. Embracing passive movement, a path to restoring mobility and well-being. Passive movement physiotherapy offers a gentle yet powerful approach to restoring mobility, alleviating pain, and enhancing overall well-being. Whether you're recovering from an injury, managing a chronic condition, or simply seeking to maintain flexibility, passive movement can play a valuable role in your journey. By understanding its benefits, applications, and the importance of finding a qualified physiotherapist, you can embrace passive movement as a path to regaining control of your body and improving your quality of life. Remember, the journey to recovery and improved mobility begins with a single gentle movement.